I want to talk to you about my friend Charlie Crawford. He's a 10-time NFR qualifier.
Charlie Crawford, time to just shake it out and win. Got it on him fast, set
there
up.
We are.
Here's a day
nice
money
run.
lead. You betcha 3-8.
That's an absolute perfect run. Timing was perfect from the time the first swing is up. He's got the control. Charlie made it happen by being timed up with his horse with the steer, and being able to not just rope, but to pick that steer's head up without changing the momentum for the heeler at all.
We know his beautiful wife, Jackie, all three of their beautiful children, the founder of the Liberty and Loyalty Foundation, which this year will exceed $1 million raised for military and first responders. I've said it 1,000 times. Charlie, it's time to rope, nod and ride, whip and spur. I want to welcome you to the Charlie Crawford Podcast. Let's ride.
Ropers, are you ready to step up your game? My online course, The Basics of Roping, is built for beginners, but packed with tools to help ropers of all levels sharpen their skills. With over 2 hours of instruction, frame-by-frame swing breakdowns, when to turn your hand over to keep your loop open, when and where to let go of your rope so you can get the horns in the middle of that loop, over 15 dummy drills to simulate real-life runs, you'll have everything you need to improve. Go to charlycrawford.training and follow the link under the course tab to get started today. Hello, everyone. Today is going to be a lot of fun in getting to know a lot more about your horse and how to maintain him and how to do a lot of prep to where if you're looking for a horse to get him vetted, if you're selling a horse, what do you need to know? So I'm excited to have Dr. Chalie Buchanan here, the vet at Signature, and also the managing partner there at Signature Equine here in Stephenville, Texas. Charlie, thanks for coming on.
Yeah, it's great to be here. Thanks for having me.
I appreciate this. This is going to be a lot of fun where I get a lot of questions at the clinics that I do, and a lot of them is maintaining horses, how often to shoe them, what to look for in soundness issues, how to maintain certain things. And so to be able to sit down and have your attention where you're not getting called in 8,000 different directions at the vet clinic, this is going to be a lot of fun.
It's a good thing I turned my phone off.
I can only imagine. Well, I would love to talk about just some things, we'll go down the list of some things I'd love to talk about, but what it takes to be a vet, that's, everyone dreams of being a vet. And so to be able to kind of hear your perspective and what it's going to take, how much work it's going to take, and to give people an understanding of what it's like to have a business of that, how to manage people, and, when it comes to having a vet clinic. But I really want to dive into the horse as well, where we talk about just understanding your horse. What are some first aid things that people would need to know, in case of a colic, in case of a tie-up, some certain things that might keep that horse alive from their house to the vet clinic, or if they're on the road. And then if they're on the road, what are some things to keep in your trailer to in case of emergency? And then love to go along the lines of, some of the nonprofits you're involved with, and, some of the other stallion stations you have here in Stephenville. But, man, thanks for coming. It's a good day to be inside today, isn't it?
It's a little chilly for sure.
We had a single degree or a single digit number last night here in Stephenville, and which came right off of almost a 90-degree week last week. High, they were in the 80s for sure. And then now it's cold. It does that here in Stephenville. I think a high of 25 today. And so it's a good day to be inside.
I like last week much better.
Yeah. I kind of like the cold every once in a while. When it's 3 days and then it's gone, doesn't bother me none. I like building fires. I like, being able to kind of that man versus nature, see if we can keep everything alive, kind of prep everything. But like I said, when it's 3 days and it's gone, it's a lot different than 3 or 4 months.
Yeah,
sets in.
I have clients and employees and stuff that family is from up north in Minnesota and Wyoming. I have no idea how they survive up there.
Mm-hmm.
It's crazy.
I know it.
They'll send me screenshots of their weather when it's minus 22 degrees and 40 below, wind chill. I'm like, you live there on purpose. You could move back to Texas if you wanted to. It's 75 today here, so I don't want to hear it.
Yeah, it is. It's wild to me too how hard it is. I'd love for your perspective on just what it is on animals. I know calves it's really hard on. When you go from 80 and then last night I think was 9 degrees. So what are some of the things that maybe prep, or how hard is it on horses when it goes from that high to that low, where you can kind of manage your horses when this weather's coming?
Yeah, anything like that creates stress for an animal, especially horses, is going to be difficult for them. And the main thing that a horse needs to do is you need to make sure they drink, right? So if you can, sometimes it's as simple as just top dressing their feed with loose salt so that you get enough salt in them, not just a salt block, but loose salt to make sure that they're drinking well. And sometimes you got to keep the water warm. You can buy an aquarium heater, put it in the water bucket, keeps it from being as cold and keeps it from freezing actually. And then sometimes you just put some Gatorade or Kool-Aid in the water bucket to make the water taste better. And if your horse totally refuses to drink, you can make like a slurry or a mash. We call it sweet tea at the clinic. You can just mix some sweet feed in with some water to make it taste better. And the drinking part of it is probably the most important part.
And what do you call it? Loose salt? Just
loose salt. Just go to the grocery store and buy, and you can buy a big bag from the feed store, but just buy some salt and give them like a half a teaspoon, half a tablespoon, twice a day. Just top dress it on their feed. And that'll make them drink, helps them stimulate them to drink much better.
That's interesting.
And monitor their water intake too. Like if you pay attention to what your horse is drinking, if you have an automatic water, that's going to be a challenge. But if you have buckets, just pay attention to how much they're drinking because that's really important.
Yeah, buckets would be an easy thing to manage, but a hard thing to keep it broke when it's just cold.
Yeah.
It can almost freeze the whole bucket.
A few years ago when it was -8, like I had an intern who was working for us at the time, and she was from Michigan. She's like, well, we used to put aquarium heaters in the water bucket. So I just went to Walmart in Stephenville and then went to Walmart and PetSmart in Weatherford, bought all the aquarium heaters they had, and we hooked them up in all the water buckets. It actually works really good.
Yeah, that's an interesting take.
Sometimes the horses eat them, so you got to put them in a PVC pipe or something.
Gotcha. What have you been keeping up with the rodeoing? I know you're busy. You've been keeping up with what's going on this winter. So I know you have a lot of endorsees there at Signature.
I do some. Mostly just when those guys pass through the clinic, I ask them how it's going and kind of get an update.
Yeah.
But yeah.
Man, Dustin and Squeeze and Levi Lord, they were at San Antonio the other day. I forget which bracket they were in, but won all 3 rounds.
Yeah. When they're
3-5, 3-6.
When they're hot, they're hot. Man. Those guys
when they connect, it's almost first.
Yep.
They're hard to connect with, hard to compete with when they connect.
Yeah.
I've seen where there's some new, and I know some of these guys are guys that come to your clinic all the time too. And, when you start the year after a split, Luke Brown and Travis Graves, they roped together last year, then they split. And you always want to have that new team kind of start off good to know, whether or not this team's going to connect or not. And so it was really cool where Luke Brown is now roping with Trey Yates, and they won Denver. And then Travis Graves is now roping with Tanner Thomason, and they won Fort Worth. So
that's cool.
The new teams of the year is off to a pretty good start.
Rolling along.
Mm-hmm.
Yeah, I like that. It's good. Those guys are such good guys, man. In the professional horsemen in the PRCA, the rodeo guys, like they're just next level, man, and different than everybody else. They are honestly, they're professional athletes, right? And you just pull for them, hope they do good because they're all good guys.
Yeah, and you want to see them, but then in a sense you don't, because the hard part is then when you do see them, something's going wrong. And it's kind of like some of the friends that I've had that throughout my career that were vets and they're friends. I'm like, well, I hope I don't see you for a while.
Yeah. Well, the best visits are the ones like, hey, we're going to go, we're fixing to head to Denver. Let's just check and make sure the horses are good. And they come in, you look at them, they look really good. Like those are good because then you get you can chat a little bit, catch up on what's going on in their lives and keep up with that kind of stuff without having to have a problem.
Now, who are some of your endorsees there at Signature?
Man, we got a lot. I don't hate to dive off into too many of them without acknowledging all of them because honestly, we endorse a lot of other futurity guys now. But I mean, you and your wife both are endorsees of ours. And then Coleman Proctor, Travis Graves, Colby Payne, Haley Kinzel, Alyssa Riley, Alyssa Urbanik. Like we got a lot.
Yeah. And then Kelsey Mowry, I've seen where she's in and out of there quite a bit as well.
Yeah.
Man, what a year she had.
That was cool to watch that barrel racing at the finals.
Son of a gun.
Yeah.
Yeah, because you have both of them, her and Haley. And man, what a title bout.
Yeah, it was. It was good to see Cassie win because it meant a lot to her.
I think for me was, being such a fan of her from the sidelines because, I've heard so much about her, how just an unbelievable jockey trainer that she is in the futurity world.
Yeah.
And then I thought I heard the number of maybe only went to 27 rodeos and made the NFR and then win the world. Yeah. And that is a phenomenal stat, just that alone. But then just the title bout that her and Haley had.
Man, that was a lot of fun to watch.
At the NFR was amazing.
Honestly, couldn't involved two better people, man. Such just outstanding individual people.
Because we've always seen the calf roping title bouts, a lot, the Fred and Cody and Joe B era and things like that. And you're going to start seeing that, I think, now with Riley Webb and Mayfield and, a lot of those guys that are going at it now. But, I remember some of the title bouts within the barrel racing, with the two top horses in the 90s, 2000s and stuff like that. Then to see those two go at it again was kind of it's a monumental historic moment. And especially for what Cassie has done, through the fraternities, and now the whole world got to see how truly handy she is. So it's pretty cool.
She might be the best horse person I've ever been around. Like her ability to connect with a horse and get one trained, like it's impressive.
Well, I think Sister too was amazing when she got out there because she was on fire.
Yeah. Yeah. She had a pretty good year and stayed healthy all year. And last year she got hurt right before the final. So she wasn't in very good shape when she got there and didn't perform like she should have. And this year, man, she was rolling.
Yeah. And then ended up she ended up not competing in the 10th round. Sister did. Yeah.
She had a little injury that took her out and just probably could have.
What was it?
She hurt her hamstring.
Yeah,
and probably would have been fine to run her, but made the decision that was best for the horse, which is
how cool is that?
Yeah, it's good.
Where Haley Kinzel has the best horse, and instead of that's something that for a lot of us we didn't get to hear, because it was just all week watching it. It was just Sister's not competing, but no one really knew why. So that was interesting to hear kind of what that was, but then also could have or couldn't, and then chose the horse instead of the title. That's
tells you what kind of people they are.
That's exactly right. Yeah. That's pretty cool.
Yeah. She'll be back soon.
Her and Jackie, they Haley Kinzel and Jackie, they commentate for Teton, so they've been at the American, and so they all drove up together, her and Katie Kaufman and Luke Branquino, and so I think some of you guys can probably get on their social media and just see what those guys get involved with.
They get into trouble.
It's so funny. They'll sing to each other, and oh my gosh, they'll pull pranks on each other. It's interesting just to kind of watch the social media for that crew to get in the same rig and go to the rodeos. Almost more entertaining than the rodeo sometimes.
Yeah,
it's been her and Luke. I've seen them having dance off competitions, and it's pretty interesting to watch.
They're not introverted, are they?
No, they're not. They're not. Probably you or me. I'm not gonna publicly dance without. Soberly, that's for sure.
It's going to take a lot for me.
So Signature Equine was Brazos Equine before that.
Brazos Valley Equine.
Brazos Valley Equine, and now there's a name change. What created the name change?
So you want the short version or the long version?
It's cold out. I don't have nothing but time today.
All right. So we started. My father started Brazos Valley Equine Hospital back in the early '80s. And somewhere around 87, 88, built a freestanding practice in Navasota, built a facility. And I worked there through college, vet school, worked there when I got out of vet school. And as my life transpired and I started driving around a lot more, doing trips to Weatherford and Oklahoma, going to shows, the business in this part of the world grew. And we opened a practice in Morganville, Stephenville, Texas. And we had a practice in Rockdale. Which then moved to Salado. And then we had a practice in Cypress, Texas, down by Houston. Then we started the standing station, and we had a very sizable, multiple locations. Had a practice in Brazil for a little while. Being a partner in the way we set that up didn't work out to where we could run it effectively. We built the practice so that everybody had autonomy. Each practice had autonomy. And that was, I think, probably the right way to go about it. But as you tried to build a consistent brand, it became exceedingly difficult. And we ended up arguing about stupid things that didn't really matter much, but it made it difficult to manage the practice and grow the practice. So we made the decision to split it up. And that was probably 3 years ago. We changed our name to Signature Equine Hospital. The partners and owners that were local stayed. And then the standing station, which is now Valley Equine Reproduction, stayed with us as well. So, same ownership, nothing changed other than the name. And then the other practices kept the Brazos Valley Equine Hospital name just because they were in the original location. So,
and then being a vet is kind of in the family.
It is. Yeah. My dad's a vet. My brother's a vet. My wife's a vet. My brother's wife's a vet. So we have a lot of vet conversations at family meetings. Yeah.
You can definitely almost have a meeting just at dinner.
We can, yes.
Kind of keep up with what's going on. And
the non-vets don't always really appreciate the topic of conversation. Sometimes it gets a little weird, but it's okay. It's just the way life is.
What does it take to be a vet? Going to school and the hours and maintaining your, I would say, sanity as well.
Yeah, but it's a commitment, right? It's a commitment in high school because you miss out on a lot of things your friends are doing because it is the hardest professional school to get into. It's harder than medical school, harder than law school, harder than dental school, right? They have to make good grades. So there's sacrifices to be made all the way through graduation and honestly after graduation. Like it's a lot of work. So you got to be prepared. It's 8 years of college for most people. My brother, who is significantly smarter than me, he got in after 3 years of college, so he got out in 7.
Wow.
And then he did actually an internship in a residency, double boarded, like big brain, really smart. Yeah. So that, like, if you want to be a specialist, then you're 8 years of college and then 4 years after that.
Wow.
So 12 years invested.
And then after college, is there a certain amount of internship that you have to go through as well?
It's not required.
Okay.
There's a lot more internships available. So when I got out in 97, there were 3 private practices that would take you as an intern. That was Littleton in Colorado and then Haggard and Root and Riddle in Kentucky. Other than that, you had academics. You went back to vet school. So not many people did those and they're pretty competitive. And now, like, we have 4 interns at our practice and there's 50, 60 practices across the country that will take interns. So the opportunity to get more training, because the caseload at the vet schools is not very good anymore. Most of that gets gobbled up by private practice just because you can be so much more efficient in a practice versus an academic setting. So the skill level for a lot of the veterinarians, again, it's not where they need to be to go be a practicing veterinarian. And then the knowledge base of what you expected to know, so much more than 1997 when I graduated, right? So you just need to get some more skills. So a lot of people that are going to practice in the equine setting will do an internship for a year.
Is there a lot of, once you become a vet, is there a lot of this continual education that you're always doing as well?
Yeah.
Where things are updating, obviously.
It's required to get your
required?
license. Yeah. So it's somewhere between 20 and 30 hours of continuing education a year is required. And some of it's good, some of it's bad. You can satisfy those requirements without learning anything. And a lot of it's a social engagement. But if you want to be great, you better go get some good continuing education.
What are some of the hours that you keep during the week? And is it something you've learned to manage through time and experience, or, was your hours different when you're first getting started to where maybe you're at now, or certain days a week?
Well, or
is it just 24 hours a day?
2 sides to that question. And one is me specifically, which is probably not healthy for very many people. And then there's the veterinarian to be successful, right? So on a personal level, I do spend less time practicing in the clinic than I used to. When I first got out of vet school, I would do anything and everything I could to get to work on a horse, right? And I did a lot of stupid things, and I drove all over the country. Like I would go to Fort Worth, to Oklahoma, to New Mexico, to Louisiana, to Mississippi, to Alabama, and I still get around, just not quite as much as I used to. And it wasn't anything for me before I moved up here to Stephenville, I would leave my house every Tuesday and every Thursday at 2 a.m. And we'd make the rounds. We start sometimes up in Ringgold, Oklahoma, Bill Riddles, and we come through Bowie to Weatherford to Stephenville to Dublin, and then get back home. And most of the time we would get home about 2 a.m. And after about 4 years of doing that, the opportunity to move up here and buy Dr. Russell's practice in Morgan Mill presented itself. And I was like, that's probably a pretty good plan. My kids were little. It was a challenge to talk my wife into moving. But it was probably the best thing for us, because this area, and Morgan Mill specifically, is a great place to raise kids. Like, the school's good, the community's good. Like, it was a really good move for us. And for business wise, it was also very successful. So went from working 80 hours a week to probably 65, 70 hours a week that I do now.
What year was the move to here in Morgan?
2006.
2006. So you got ahead of the curve then too.
Yeah. Yeah.
So you started seeing it just, because I would say this 2006, it kind of was starting to migrate this way.
Yeah. So when I told my parents that we were going to move, and talked to my dad about it and expanding the practice, they were like, I don't know. So they just came up one weekend, just to look around and talk to Dr. Russell about, negotiating at the buyout of the practice. And I think we're in Chili's, honestly, in Stephenville. And we're just sitting there. My dad's looking out the window and he's like, holy crap. He's like, you got to move. I was like, well, what's that? He's like, we've been sitting there 15 minutes and 20 trailers drove by. Like this place is covered up with horses and it's going to be a good deal. So and it actually worked out really well because it's just got nothing but better.
Yeah. Yeah. What used to be 100-acre ranches, 500-acre ranches are now almost getting split up into 5-acre, 10-acre, 20-acre lots around here, where it used to be fields of coastal fields around here that you drive around, and now they're all basically barn dominiums with arenas.
That's right.
And with however many horses.
Yeah. And the political climate in the Northeast and the West is good for Texas.
Yeah.
And those, honestly, the real estate prices is good for Texas because as high as it is here, they can still sell a place in California, 20 acres, and they can buy a 100-acre place here for the same price.
Yeah. It's definitely, you've definitely seen a lot of, I think with a lot of the pros being here as well, but I think a lot of the pros being here as well is because of the opportunity. There's so many ropens here now. The college is here. The main guys here, so open ropens. You have Fort Worth, and then a lot of the rodeos in the wintertime and the opportunity of the jackpots. 377 Arena now being developed here in Stephenville has brought a lot of team roping back to Stephenville again too. And so it's been amazing to see, the cowboy capital of Stephenville, of the world, and that, it's a very like-minded town. Yeah. It's, you go to town with your boots on, your spurs That's on, right. you're just another one that walks through the door.
That's right. I would real quick to touch on, because there might be some people listening that may want to go to vet school. Their kids may want to go to vet school. The opportunity to have a good quality of life and be an equine veterinarian it's real deal now. Like when I came out of vet school, like it was me and my dad and one other veterinarian, and me and the other veterinarian were on call. We took turns 7 on, 7 off. We didn't have interns. Anything came in, you just handled it, right? And it was a lot of work. And that right now, this practice in Morgan Mill, I have 10 veterinarians, right? So the opportunity to not be on call all the time and work 5 days a week, 40 hours a week, 50 hours a week, like it is, and make a good living is an opportunity that you shouldn't look past. So the reality of being an equine vet, it's probably not as good as being a small animal vet and living in downtown Fort Worth or Dallas, working 4 days a week and making $200,000 a year. But if you love horses like I do, it's a very good opportunity.
What are some of the things that you do to keep from burnout? Because a lot of people in and out the door, a lot of bending over, a lot of horses that, probably ill-mannered. And I think that, I would say that how you take care of yourself and how much sleep and certain things like that probably go into it. But what are some of the things that keeps you passionate about what you're doing with that, where I'm sure you've been burnt out, and then I'm sure you've learned how to maintain it. So what are the things you've learned?
I definitely have some kind of entrepreneurial pathology. And I really enjoy building and growing a business. And we've done multiple different businesses on that front. So I'm not a very good example of that, but I can tell you what I do personally to keep myself in good shape. And honestly, I've been down a journey for about 5 years. I had some health problems in my back and my neck. And it changed how I went about my nutrition, focusing on sleep, actually meditating and doing yoga, and working out, like those sorts of things. If you're struggling with that, like the number one thing, honestly, and it's not a big secret, you hear talk about it a lot, the people who help you with longevity and wellness, sleep's the most important thing, right? And you really got to focus on that. I struggle with that a little bit. But I think if you can get 6 to 8 hours of sleep at night, everything else kind of takes care of itself. So I don't really have a problem with burnout because there's probably genetically something wrong with me that most people don't have. But as a general rule, my attitude at work and my ability to communicate and do good things is way better when I get good sleep and good nutrition.
Mm-hmm. What about nutrition? If you don't mind breaking down some of the things that you do to try to stay healthy and what you eat, and then some of the things you've dealt with that are now no longer an issue because of probably the nutrition you eat.
For sure, I quit eating sugar. I try to eliminate all added sugar and processed refined sugar out of my diet, and which is virtually impossible. You got to read the label on what you're eating. And if you eat actual food and not processed food, that becomes infinitely easier. And then, it's not difficult, but it's hard, right? To eat well. You just have to, and to be in a very busy practice, like your only option sometimes are fast food. You just got to make good decisions. And sometimes
especially rodeo and traveling, it is hard, isn't it?
Yeah. So have a protein bar or a shake instead of eating at Wendy's is not a very fun choice to make because Wendy's tastes a lot better. But if you have the opportunity to even just call in an order at a restaurant where you're eating, you get actual food, then that's just better. Like just small decisions like that. And eliminating the processed food and the sugar, honestly, for me was a huge difference.
Well, I've read that if you're reading the ingredients and if you don't feel like your great-grandmother could recognize what the ingredients are, it's probably not great for you.
Yeah, if it's got more than 3 syllables, don't eat it.
Yeah. And then also I've heard too where it's the single, the single food, if there's single ingredient foods. So basically steak is a single ingredient food, chicken, fish, broccoli, the things are just single. Yeah. That was for me, that was probably the simplest way to kind of understand basically that if God didn't make it, it's probably not the greatest thing for you.
Eat actual food.
Yeah.
That's important.
Mm-hmm. What are some of the things that you dealt with that all of a sudden now you felt like with eating better has helped you?
Oh, my physical well-being, like sore knee, sore back, sore neck, those things went away, right? I actually lost a pretty significant amount of weight, probably about 40 pounds, which also helps your knees and your back and your hips. And then just my attitude on life is just better, right? My staff will tell you that I'm not near as grumpy as it used to be. I don't get mad as easy as I used to be, those sorts of things.
But you said your neck too, there's some issues you had too that has helped just with certain things too that are just some chronic issues. But that's pretty cool too, because I didn't understand too because I deal with my back. I got back issues and stuff throughout my career, and I didn't realize till I kind of was going to physical therapy and talking to nutritionists, but I didn't realize there were certain foods that were inflammatory and certain foods that were anti-inflammatory, and so when I'm dealing with an inflamed disc, things that I eat that are going to create more inflammation, and then certain things that I eat that create less. And I mean, I had no idea about certain things like that. So it is amazing to get to know more about nutrition and kind of like you say too, is how it also affects your attitude and your well-being.
Yeah. And what we do for a living, being in the horse business in general, not just being a veterinarian, horseshoers and people that train horses and rodeo for a living, ride horses for a living, right? That it is a physical, demanding way to make a living, right? And if I could give one piece of advice to everybody, if you're younger than me and you hurt yourself, fix it. Don't say, oh, it'll be fine, and just cowboy up and get through it, because those things, when you get to be 53, have a way of coming back and biting you in the butt. So if you fix it when you're 35, it's not a problem when you're 53.
Yeah. And
then your whole life gets much better.
I agree with that. So let's go down your realm now, because this is going to be fun, because with the amount of clinics that I do throughout the year, there's always a lot of questions that I'll get on maintaining horses, soundness issues, what to look for in conformation in horses, to fitting their horses in white marks, to knowing the difference between a tie-up and a colic. And so this is be fun, I think, too, is just kind of going down some of the things for people, especially a lot of people that follow this that are just getting into the industry, understanding horses. But I'd like to start with, what are some things that you need to have in your tack room or your trailer in case of emergency, and what would some of those emergencies be that you would need to keep, basically a vet kit of a first aid kit for your horse?
Yeah. So first of all, almost everything we're going to talk about can be administered IV, intravenously, or orally. So if you are not comfortable hitting a vein, the next best option to administer the medication is going to be orally. I wouldn't give a lot of those things in the muscle. I mean, even if it says on the bottle you can give it muscle, Banamine specifically, has a lot of side effects if you give it in the muscle. So if you can't get it in the vein, and even if you get it in the vein, you get some out, it's not the end of the world. Like, you can overcome that, but I would give it orally first. So the number one thing that I would keep in my tack room is Banamine, right? Because it's going to help you in so many different ways. Swollen leg, horse is lame, colic, tie up, almost any emergency that you're going to have, you can give that horse Banamine. It's going to help. So on a 1,000-pound horse, that dose is going to be 8 cc's. It's going to go in the vein or in the muscle. So, the next thing I would have is some kind of.
You said vein or in the muscle?
I'm sorry, I said in the vein or orally. Sorry.
Orally, yeah.
Sorry.
Yeah.
The whole thing about telling you how to give
anyone
muscle,
knows that on the muscle. Because we've had to do it before at my house. My dad had some horses that, or had a horse. I remember one time, I think we just got it very, very watchy. You could not get it in it, like he would paw you, wouldn't let you get him around the mouth. And we're like, he was colicking. And I think it was maybe the neighbors. I couldn't remember. Either way, it was like, well, we're going to have to, he's got to have something.
Yep.
So we ended up giving it to him in the muscle.
Yep.
And we got by.
Yep. But
that was rare from what I've heard. If you give Banamine in the muscle, what are some of the side effects? Because I've heard some of them are not good.
Oh, so if you get infection, like it can make an abscess, and it can be a Clostridium. If you get a Clostridium infection in the muscle, like there's a chance it kills the horse.
Mm-hmm.
Right? It's that bad.
Yeah.
And it's not a high incidence of that. But if you give it orally, the incidence is 0. If you don't have any other option, right, and the horse is colic and you got nothing else to do, then you can give it in the muscle. It's fine. I would give it in the neck or in the chest. If you give it in the chest, if you can do that safe without getting pawed, that's going to be your best, because if you do get an abscess, it's easy to drain it. So yeah, I mean, sometimes you got no option.
Mm-hmm. What are some ways? Well, first of all, before I get down the rabbit hole too much, but what are some of the things also you would have in your vet kit? You know, as far as going down the road or having in your tack room. Yeah.
So you need some kind of wound treatment, Furacin or Silvadine or SSD ointment, and a way to wrap a leg. So it could be just a non-stick Telfa pad or some gauze and a polo wrap and a quilt, or you can have like pre-packaged bandage material, but you need to be able to put a wrap on it and something that's safe to put on pretty tight. So it has to be a lot of padding. So if you have a laceration to a lower leg, and it's bleeding a lot, you just put a bandage on it and get some pressure on it, and it'll stop. And then if you have a wound that you need to dress, you need to have some kind of medication that you can dress it with. And it probably is not a bad idea to have some kind of sedation. Democedan or xylazine or romifidine, which is Sedivat. Any of those three are pretty safe. And you can give those orally, IV, or IM. They're all safe anyway.
IM muscle.
Yep. Those are pretty good. And then that way, if the horse is like stressed and anxious and a little fractious, you can kind of slow them down enough that you can assess the situation good.
Do you like it a little bit better than ACE or Rompum?
I do, yeah. So Rompum is xylazine, the same thing.
Okay.
ACE has a vasodilatory effect, so if it dilates the blood vessel. So if you have an emergency where the horse is bleeding, you give him ACE, you might make that worse, compound it. So I would give the xylazine.
Interesting.
Rompum, something like that. And then those also have some side effects that they are pain management for a horse that's colicking pretty bad. So if you need to get them somewhere to get them to the vet, you can buy yourself 30 minutes to an hour on a horse that's very painful. At least get him in the trailer and get him transported. So, and then how many, like, needles, gauges, things like that, syringes, what are some cc's that you would keep on hand as well? You can buy the prepackaged, pre-needle on 3 cc syringes. Those are going to be for the sedations. And then I would keep some 10 cc, 12 cc syringes to give Banamine or Bute. I mean, Bute's another option as an anti-inflammatory. What about needle sizes? I like 20 gauge, 1.5 inches or 1 inch. If you're going to give a lot of shots in the vein, the 1 inch is a lot easier to manage. If you're going to give something in the muscle, 1.5 inches is going to be better, so you can put a little bit deeper in case it does get some inflammation. It can get absorbed a little bit better. Now, the gauges on the needles always throw me off because
Is it the smaller the size, the bigger the needle?
The bigger the number, the smaller the needle.
So a 20 gauge is a smaller size needle than an 18.
Yes.
Correct. Because like the 18 is probably more for like your penicillin,
Exactly.
some thicker stuff. Correct. And then your 20 is for your lighter liquid, especially like in your veins.
Yep.
Correct. Or if you're going to mainline one.
Yep. So honestly, we have a running joke at the clinic. I give my interns hell because you get some of the really thick medications like Exceed, and they'll go grab a 16 gauge needle to give it. I'm like, that's not a cow. This is a horse. Grab an 18 is fine. It's okay to go a little slower.
Yeah. What about IVs to learn how to mainline a horse? Is there anything that you like on YouTube or anything like that that's a safe way where people can learn that, or is that something that kind of needs some supervision?
I think it's easier if you can learn it in person. But
because that's a good one. You know, I mean, I don't know how many times did it felt like that. You know, people have gotten a shot in that horse, and it did save their life from their house to the vet. You know, so things like that it's an important skill.
You know, probably a couple of times a month, I'll have a client come in and wants to learn how to give an IV shot.
So you can go to your vet and kind of get it.
For sure.
Got it.
And just the main thing is you need to have a relationship with the vet if you're going to own horses, right? And you just need to be friends with them so that if something goes sideways at night, they call you back. And my clients have my cell phone number. Probably half the populated world has my cell phone number, honestly. And I answer it almost 24/7. But yeah, build a relationship and then ask your vet to teach you how to do that. And then go home with a bottle of saline and some syringes, because if you get the saline out of the vein, it doesn't matter. It's not going to hurt anything. So you can practice with that and not actually give in a medication, because some of those medications can be pretty irritating if you don't get it in the vein.
That's something that I always recommend for guys that are just getting in the industry. They're beginners, you know, learning more about your horse. But then also for a lot of parents, you know, their kids are going to graduate. They're going to head off to college. There's going to be certain things they need to know, in my opinion, early enough. So when they're out there on their own, those are little things that I think that could keep that horse alive, you know, especially here in Texas where we have such a flux up and down weather from 80 to 9, you know. It is hard on their guts. It is hard on, you know, if they're not drinking enough and things like that, where if there's an emergency, being able to hit that vein. And
honestly, if you can give some Banamine and even a little xylazine to that horse, sometimes you just avoid having to come in at all. Like they're not eating, they feel a little puny. You give them some Banamine and they start drinking and they, you know, get over the little episode and you don't have to take them in.
What tie-ups and colics has been something that I remember as a young kid, has been something that they can kind of cross into each other. For, you know, there can be a few things where they look a little bit similar. So what are some things that you can kind of tell whether the horse is colicking or tying up, and also what are the medications you would give him?
Okay. So tying up is basically the horse's whole body's cramping up, right? It's a electrolyte imbalance or the overworking. Not even sometimes they're working. Sometimes it's just they've been off for a while. You put them on the walker and they tie up, right? Some horses are really prone to that. It's a energy storage issue with the muscle sometimes as well. So when they tie up, they can be painful and they can paw just like they do with a colic, but they'll be very reluctant to move. If your horse is pawing and uncomfortable and they walk around normally, it's probably a colic. And if they walk like they're stuck in the mud or they take really small steps, then it's probably a tie up. And then also a lot of times they'll just be really tight all over the body. Like you just palpate the muscles on their back and they're going to be rock hard. That's probably going to be a tie up.
What are some medications you can give and what is the treatment to it? Because I've seen some of them where guys try to ride them anyway, and it that can be pretty detrimental to their muscles, correct?
Yeah. So the two things bad can happen there. One is that they can actually tear a muscle. And the second thing is that if you get enough muscle damage, you're going to release myoglobin, which is what's in the muscle that holds the oxygen, into the bloodstream. If you damage it enough, you get enough myoglobin into the bloodstream, it's going to bind the oxygen that the red blood cells don't get. And then you get kidney damage. If you get bad enough kidney damage, it can be terminal for that horse. That horse can die from a really bad tie up. So if they're tying up and riding them anyway is a really bad idea. But if you have a horse that's tied up, the first thing I would do is give them Banamine, honestly.
How much?
8 cc's.
8?
8, yep.
Okay.
And then once they're comfortable enough, if you can get them on a trailer and get them into the vet, they can run some blood work and see how bad it is. And if you do have a bad enough tie up, they're going to need some IV fluid for a couple of days just to kind of flush the system out so you don't get the kidneys damage. And that's going to, most of the time you give them a shot of Banamine and they're fine. A couple of days later, they go back to work. Is there anything you would give them to relax them? Yeah, if you can have some muscle relaxers around, you can have methocarbamol, which is going to be, there's different ways to get it. You can get it in a suspension of paste or pills, but 5 grams is going to be the dose of that. And we do that a couple of times a day. You can also give dantrolene. If you want methocarbamol for an acute type, is probably going to be better than the dantrolene. Dantrolene is going to be a little bit easier on the system. If you had to keep them on it for a week or two, after the tie-up, it might be a better choice. Because we've had some tie-ups, and the first thing we'll do is Banamine, and then we've also done, is it bad to give them either ACE or Rompum or a Setavet, things like that, just to relax things a little bit? ACE is not a bad choice for that because you do dilate the blood vessels that go to the muscles and helps them relax a little bit. And I would give them a little bit of xylazine or Rompum as well. Okay. Yeah. And because I know with this cold, and especially like people in the north, March is coming around the corner, so a lot of these horses have been turned out. Probably getting full feed, haven't been getting used, so when it starts warming up, if your horse is known to tie up, what are some ways you can kind of bring that horse back when you're starting to get him legged up to where, what are some simple ways where maybe you can avoid the tie-ups? Yeah, so there's a couple reasons. One is if they're just out of shape, right, then take your time, right? You're going to put them on the walker to walk 30 minutes for an hour, for about 4 or 5 days. And then you're going to do that twice a day for 4 or 5 days. And then they can try a little bit for 4 or 5 days and kind of gradually put them back into work. And if it's a normal horse, that's going to be fine. Right. And I think, let's say the horse has been off for 6 months. We might get off in the weeds on this one a little bit because I have strong feelings about this. So let's just say you have a horse that's been in work its whole life. Right. And now it's 10, and it's a rope horse and it's going to get, the winter off. You're just going to turn it out for 6 months. Right. There's a lot of things that happen to that horse. And one of them is that you lose the bone density that they develop. You're going to lose tendon and ligament tightness that they've developed from being in work. So not only do you have to get the muscles right so they don't tie up, but you have to get those things back together as well. And that's going to take you 2 or 3 months to get back in shape to go be a top-end competitive horse. So the take-home message from that is going to be, even if you're going to give your horse 6 months off, they probably need to be in some level of exercise along the way as you go, even if it's just riding them walk, trot, lope 3 times a week. And that's going to maintain the health of the bones and tendons and ligaments because you need concussion of hitting the ground to maintain that. It's also going to keep the muscles in better shape. So the second part of that is that if you have a horse that has what's PSSM, is a genetic disease that doesn't allow horses to store carbohydrates well as energy in their muscles. And those horses are the ones that are really prone to tie up. And if you have a horse like that, the genetic test is not 100%. So there's a lot of quarter horses, specifically cutting and cow horse bred horses, that will test negative on a genetic test, but still have it. Those horses need a low starch, high fat diet. And the main thing, the most important part for that is that when you go back to riding them, you may want to put them on some dantrolene or methocarbamol just for the first week as you go back to exercise and to keep the muscles relaxed and soft so they don't tie up. Is there supplements and things like that for those issues? There's thousands of supplements for that. There probably was. Yeah. And anything that you like, man, this one really stands out to me that has helped, or just try some to where you kind of find out what works for them. Yeah, I think we helped develop a supplement called Recovery. That is, I think it's only sold through vet, so it's a little hard to get. But it has astaxanthin in it, which is what makes salmon pink. It's a pretty potent antioxidant, and it has some other things in it that's good for the muscles. And then vitamin E is good for the muscles. Selenium is good for the muscles. Magnesium is good for the muscles. So any of those supplements that'll have that in them are going to be good for you. Yeah, there's supplements that have that. There's even salt blocks that also carry that as well at the feed store. Yeah, that you can kind of keep in front of them by their water. Yeah, that would help with that as well. Yep. Okay. Electrolytes are going to be important, especially in the summertime. If they're, if it's hot, not just salted.
That was some of my questions I had for later, but since you touched on it, what is some things to keep in your trailer, like for guys rodeoing, or even just for, I remember when there was a high school finals in maybe Illinois or somewhere in the East where it was very, very humid. And a lot of them horses from the West, they weren't used to that, man, horses having heck, tying up colic and things like that. What are some things when it's hot to keep in the trailer and keep in front of your horse as well?
Electrolyte paste is going to be good. And back to the salt again, right? If I was hauling a horse all the time, I would definitely top dress the feed with salt to make sure they're getting it, and then keep some electrolyte paste around, or even some powder. A lot of my clients who go hauling around, they just sometime around April, they start adding electrolytes to the horse's feed program every day. Just keep them on it. It doesn't matter where they are; they just keep them on it until it cools off.
Yeah, that's a good one. I've seen that a lot, especially from, where we come from, being from the Northwest, going, I remember when we would, even from Texas, just going to some of them rodeos in the East, I think Missouri, I forget one of the ones that we used to go out there, but man, just the humidity we're not used to, the horses are not used to it. And seen a lot of issues when they would go there because they're not climatized for it. And I've heard it's a lot easier to take a horse from the South and go north than it is from a horse that grew up in the North and go, say, South Texas.
For sure.
I've heard that's a shock to their system.
Yep.
So,
yeah. And then if you're talking about barrel horses, like if they're on medication for their bleeding, like they have EIPH for their bleed when they run, they're on Lasix or something like that, you're going to need to bump that up a little bit. And if you're giving a lot of Lasix, you're going to definitely need some electrolytes as well.
What about colic? Because that one's pretty common, it seems, amongst rodeoing, because that one's tough in the fact of, I've lost one of my good horses to colic. He was notorious for colic and had to have surgery, and then he ended up dying in 14 after the rodeo. And I seen Tyler Wade, he had a really good horse coming up, and that one, he just lost that one to colic. And so first of all, is there certain things that cause it that can be avoidable? And then what are the things that are not avoidable?
Sometimes it's just unavoidable, right?
It seems like a lot of times it is, yeah.
Hydration is really important, right? And lack of hydration causes all the secondary stuff a lot of times. So if you keep those horses well hydrated, the likelihood you have a bad colic is going to be lower, but it's not zero, right? Sometimes it's just so we keep horses confined, and we feed them concentrated diets, and it just does bad things to their intestinal system. So it's mostly man-made, and there are things, structural problems that older horses get that cause them to colic, and there's just anything to do about that. But I think if you have your emergency kit and you have Banamine in it, and you have a drug called Buscopan, which is a smooth muscle relaxer, so it helps like a little gas colic. It relaxes the intestines so they can pass that. If you give 8 cc's of both of those, the Buscopan is going to have to go in the vein. If you give both of those and the horse not any better, you need to get your horse somewhere pretty quickly, because it's not going to be just a typical colic. If you give both those things and they're fine, you're probably fine. I would, let's just say you're at a rodeo and your horse is colicking. You give it Banamine and Buscopan and they're fine. I would pull the feed, water only, until the next morning. And if they're fine the next day, just go about your business. No big deal. If you come back in 30 minutes and they're still colicking, you better put them on a trailer and get them somewhere.
What are some of the signs that you see that are a dead giveaway this horse is colicking?
Oh, yeah. So not eating, pawing, rolling, obviously. And some of them are just like dull, hanging out in the back corner of the stall, right? And some horses are just amazingly tough. So
I've seen some of them where they stretch out.
Yeah.
I've seen some where they bite at their stomach. They just get mad because it's hurting, running themselves into the side of the whether they're tied up to. I've seen some where they're so miserable they just look like they're almost trying to hurt themselves because they're hurting so bad.
Kick at their belly.
Yeah, kick at their belly.
Yeah.
What is it? So like what I mean by that is, what is a colic? What is it that's going on inside that horse that is making this the pain, and what is it that it basically either kills them, or what is it that's happening that's creating this pain inside of them?
The pain comes from the dilation of the intestine, whether it's a colon, small intestine, the stomach. If you stretch it too much, it's painful, and that's what causes the pain. So gas colic or an impaction or even a twist, right? It's all the same, right? It's a pain response to the expansion of too much of the intestine, right? So let's just say an impaction is probably the simplest, right?
So an impaction would basically be where they're not crapping, they're not
That's
pooping.
right. Yeah, it's just got hard and dry, and it's stopped moving through. So then everything behind it backs up, and then they get uncomfortable. So that's
when an intestine can start swelling.
Yep. Yeah. So if it expands too much, if you don't resolve it, right, then it can rupture the intestine.
So a lot of times if you catch it early, when things are starting to expand, the intestines are expanding, you catch it early, then sometimes just being able to give them the stuff to relieve the pain, and then also the relaxing to where sometimes it can just go back down.
Exactly.
Almost relax, where maybe hopefully they poop.
Right.
Stuff like that.
Exactly right.
Is there some certain things you can give them that would help create, like basically when you're compacted as a person, a couple cups of coffee, man, I'm good to go. Is there anything like for a horse that can help them with that impaction that'll help them break that loose?
Electrolytes. You can mix up some salt and some water and down some of that. That's going to help. I wouldn't do that a lot because it depends on where the impaction is. And if you put too much stuff behind it, it's not going to make it, far enough up the intestines to do you any good. Definitely wouldn't give an enema. I've had people bring the horses in. I just stuck a water hose up his butt and didn't get any better like that. It's pretty obvious. It's not a good idea.
Can't go from that direction.
Definitely wouldn't do that. The main thing is to give them some stuff to relax them if they can't pass it. They're probably going to need intravenous fluids, IV fluids. So then you superhydrate them, and then the intestines suck the water into it, softens the impaction up so they can pass it.
And then a tie-up. So explain to me the tie-up, because we're talking about gassy, we're talking about the pain, we're talking about it getting inflamed. What about when it ties up? How does that work? What does that mean when it ties up?
Okay, so we'll go a little bit into the science. All right, so when a muscle contracts, it takes energy. That also takes energy to make it relax. So when that muscle fiber contracts, it's stuck. And if you don't have enough energy in the muscle to relax it, to add calcium into the muscle, to allow it to go back to normal, that's what a tie-up is. Then you get a lack of electrolytes and a lack of energy. The muscle contracts and it can't uncontract. And that's what, in the tearing of the muscle as they're trying to move, is what causes the pain. Does that make sense?
Mm-hmm.
Yeah. So if you can get energy into them, get the electrolytes balanced back, then the muscle can relax. Muscle relaxers will do the same thing, right?
Because on a tie-up, do I understand this correct? Where when it basically, if one of the intestines can get blown up and overinflated, it can turn over, and then when it turns over, that's where the gut's twisted, and that's the twist.
Yeah.
Does that make sense? Does that sound right?
Yes.
Because I've always heard of a tie-up or a twisted gut, and I never understood how that worked or how that even happened.
So the most common twist is going to be, just a twisted gut is going to be the colon, right? So the colon is a big U with two sides in it. So the intestines come in one side, and it goes along the bottom. It goes from the back of the horse up to the front of it, and then back to the back of the horse. It makes a V, and then it flips up, and it goes back again, the same right on top of that, and then it comes out the other side, right? So there's one end of that colon that's just kind of hanging out free, and if you get some gas or something in it, it'll flip up, and when it flips up, sometimes instead of going back down, it goes the other way. So then you just twist it on itself.
So then that's when usually you're going to have to open them up.
That's a surgical. Yeah,
that's surgery to get that thing turned back over, and hopefully it wasn't long enough where it killed that intestine correctly.
Yeah. Yeah. So that's a very time-sensitive problem. If you lose circulation in the intestine enough, it's not coming back in. If you start having to resect and remove intestine, then that's a problem. The small intestine can get in little holes in the structure that supports the intestines, and they can have obstructions, and they can have you can lose circulation to that same thing, but it's usually not a twist in the small intestine.
Now, the one that blows me away that I don't understand at all is founder. And what I mean by that is, I've heard that they can stress founder, which is incredible to me, that something in their mind can create their bones to rotate and do certain things. I've heard feed. So can you kind of explain to me a little bit about founder and what are the signs are and what are some of the things that can create it?
Yep. So founder is laminitis. The lamina is the structure that holds the hoof wall to the coffin bone, which is in the foot, right? And it is a amazing design that you can support a 1,200-pound horse on that, and everything stays together, and they can do what we ask them to do. Like, it's actually, if you can dive down into the science of what the lamina looks like and how it's put together, like there's no way you can't believe that God doesn't exist, because the way that is designed is just freaking amazing. The amazing ability that it has, the strength that it has, right, is phenomenal. So if you have some kind of insult to the lamina, whether it's stress or toxins in the blood that can come from the diet, can come from other things, then they swell, and which is very painful. And if you have enough damage to the lamina, you lose circulation to it, then the lamina die. And that's when you get rotation inside the foot. And that's what causes it. So the deep flexor tendons on the back side of the leg pulls harder than the extensor tendon on the front side of the leg. And the lamina's job is to hold everything into place so that the horse can propel itself across the earth, right? If you lose the structural integrity of the lamina on the front, then you just pull the coffin bone inside the hoof capsule downward, and that's what causes the rotation and the separation at the toe. We can go way deep into what can cause it if you want to, but basically, the most common things are overload of carbohydrates. So you get too much sugar.
Because that's where I've heard where, like when I was a little kid, my dad said, make sure that horse doesn't get loose and get in that grain of founder.
Yeah.
So if he gets in there and he eats too much grain, what is it?
Sweet feed.
Sweet feed or sugar.
Yeah,
okay.
Sugar. So and we do so much of a better job of feeding our horses these days. Like, that doesn't happen very often. Every now and then they get off in the cow feed or the goat feed or the bird feed, right? And they'll get that. But that doesn't happen very much. The stress founder, like a couple of years ago when it was like 120 for 2 weeks in a row down here, we saw a lot of horses that got stress founder then, right? And it's just inflammation inside the foot. Do you get a lot of toxins in the body just from the stress that they're under? And then the other most common thing is like older horses, if they have a metabolic disease called Cushing's, it causes similar problems that they do with the carbohydrate overload that has a lot to do with insulin and glucose and in the bloodstream, but it causes inflammation in the lamina as well. And it is, honestly, it's a devastating problem.
Mm-hmm.
Right? Like, you can have a horse that has an injury on one leg and they put all the weight on the other leg. If you do that long enough, you don't get good circulation in the foot, and then the lamina dies. You get compensatory laminitis in that foot, and they founder, and those are bad.
Mm-hmm.
They're really hard to manage.
Yeah, everything we've talked about, I've had, and it's always been amazing to me that something that what they're thinking about or the stress or what they eat can create something that can change a bone. But how you explained it does make a lot of sense now.
Yeah,
those are devastating when those things happen.
Yeah, it is.
Especially if it's stress and certain things. We've had one here a couple of years ago. It was one of Jackie's fraternity horses. Unbelievable horse. Probably one of the kinder athletes that we've had, that no matter what this horse was going to do, he was going to be great at it. And just all of a sudden he kind of started acting a little bit funny, like he was a little bit irritable to be around. And then all of a sudden he laid down in the box, and never, ever has that ever happened, And then all of a sudden we got him looked at, and then sure enough, something rotated, and then didn't catch it early enough, and then, career ending.
Yep.
And so those are devastating ones. And it's always interesting to kind of find out, I think, too, is when you have your vet, is there ways where they kind of can check blood to maintain a certain nutrition for a horse that's going to help keep them from some of these things from happening, or is that possible? Or
yeah, I mean, so the metabolic disease is diagnosable with lab tests, but those horses are typically easy keepers, so they're fat, and they'll get the crusty neck, right? If you have that, you should probably get your horse tested, and if they are, there's medications you can use to treat that with, because those horses, they're really hard to manage if they do get founder, because those are the ones that creep up on you, right? They can be very subtle until they're not anymore. The ones that are acutely lame, like all of a sudden the horse is really crippled, and you're going to tell me you're going to call the vet and you're saying horse is laying behind. It's actually not. Like he's leaning back. He travels really weird behind, but he leans back and uses his back end to unload his front end.
Mm.
Yeah, those horses, like you need to get on that really, really fast.
Because I've also heard too, ponies are very accessible to foundering.
They're very prone to have the metabolic problems.
Is that what it is? The metabolic?
Yeah.
Mm-hmm.
Yeah.
Got it. That makes sense. This episode is brought to you by CoreVive. CoreVive has a great line of products that I believe in and use every day. Their product Hydrate isn't just for quenching your thirst. It's packed with vitamin C and zinc to give your immune system a little extra boost, especially in this Texas heat. I don't do a clinic, podcast, or a pre-workout without their product Energy. It keeps me locked in, it's convenient, effective, and it tastes great. Jackie and I drink it all the time. I drink it before I compete, and it's really good for those all-night drives. I don't have a post-workout without their protein. It's grass-fed, packed with collagen, peptides, amino acids, and has no chalky aftertaste. It's a great meal replacement or a way to rebuild after a hard workout. Core Renew covers all your gut health needs in just a single daily serving. New customers get 10% off their order by going to corevive.com/Crawford. See the podcast description for the link or check the link in my bio on all my social media channels. What about, this is something that it seems like in the last 5 years I've been hearing more and more about it. Makes you wonder either how long it's been an issue or just how long back in the day we just didn't even know because it wasn't really diagnosed, was kissing spine.
Yeah.
I hadn't heard about it for the last maybe 5 years, maybe 10 years. And, you think about back in the old days when all of a sudden a horse would go to buck and it was a saddle or it was he just ain't doing no good, whatever. And you think now the things that probably the situations that the horse was going through. That's been an interesting one. Can you elaborate more on the kissing spine?
Yeah, I think that we're better at diagnosing it because we have better equipment to diagnose it with, like the digital x-rays. It's just the quality of the image you get is so much better that you can see a lot more stuff than you could. And it is, the hard part about kissing spine is let's just say you went to a team roping and you x-rayed the back on 100 horses, 50 of those horses are going to have some level of kissing spine. And 25 of those 50 are going to have some pain associated with it. And 5 of those are going to need some kind of significant management, injections, shockwave, or possibly even surgery, right? So it's really difficult to make a good diagnosis because a lot of horses have it and it doesn't bother them. But it is a debilitating disease in horses. If it's a big problem, if you have to do surgery on it, it's significant. Right?
Because I've heard one of the top trainers that had a really good futurity horse, I don't know, 4 or 5, and then all of a sudden maybe it's 5 or 6 year old year, maybe it's 6, and all of a sudden the sucker went to bucking.
Yep.
And he's like, man, that is not this horse. Went in there, sure enough, found out he had a kissing spine, got the surgery, quit bucking. But it was weird because the bucking, he said, just came out of nowhere. So he needs to say, I know something was wrong because that's not this horse's demeanor. So something to be interesting in is if a horse did go to bucking out of nowhere and it's uncharacteristic, definitely something to pay attention to and get looked at.
A lot of horses' pain response. Response to pain is bucking. Right? They're just trying to communicate their displeasure with you, specifically the back. Like the back's painful. And those horses that buck like that are usually pretty easy to diagnose because their back's sore, right? And then you can diagnose that and then fix it.
What about when you're hauling? Like for some of these people that, it seems like the hauling, because I know when I haul some of my futurity horses around, they're not used to it. Where when I was rodeoing full time, I can throw them suckers in a trailer, go, 7, 8, 9 hours, unload them, on a 16-hour trip, split it in half, and them suckers are warriors, Well, you try to do that on a horse that ain't hauled much. I've seen where tie-ups, colics, and things like that happen. So for a lot of people, like it said, when this spring when they start going to the high school rodeos or going to the high school finals, they're going to be traveling a lot more. What are some things that you recommend, or what are you kind of like time-wise on how often should you unload your horse? And also when you do unload them, what do you recommend doing?
So let's just say you're hauling to California from Texas, right? So it's going to be 20 plus hours. You probably need to stop every at least 8. On younger horses, probably more frequently than that. And then I don't necessarily need to unload them every time. The main thing you need is for them to be able to relax, right? Because they're balancing and bracing right, when you're hauling. So that's a physical event for them. And if they get the chance to stop and, relax and stand on 3 legs, take them out, let them graze a little bit. That's fine too, because it's probably good mentally for them. But I don't necessarily, if you're hauling 16 horses, you don't need to unload all 16 horses, right? You can just stop and sit there for 30 minutes, let them catch up. And then make sure they're drinking, make sure that they have something to eat while you're hauling them. I think that kind of stuff's really important. And then try to be there a day in advance, especially with young horses, so they have a chance to kind of settle into the environment that you're not going to get there this morning and we're going to show them this afternoon. That's going to be pretty stressful.
What about your opinion on tying your horses in the trailer? Where is there a certain length? Because I've heard of some of the, I think maybe it was Scooter, and there were some horses back in the day. I remember some of the good horses that got, well, what was it? Pleural pneumonia. Mm-hmm. And I think that's when we started kind of hearing it at the rodeo world, like being able to get your horses out and let them get their heads down.
Yep.
Because there's certain things that get basically kind of hung in their neck or in their wherever it is, and it doesn't get swallowed or whatever. Can you kind of break down
that's probably dust or some kind of environmental issue that is in their lungs or in their airway that they can't cough it out and get it out. If they put the head down, everything kind of comes out and it's easier to clear it. I think that I would, my preference would be to tie your horses, not super short, but short enough where they can't put their head down and get themselves in a bind in the trailer. I would make sure that I untie them before I open the partition to take them out so they don't set back and hurt themselves. And for the love of God, keep the windows closed. Like it scares the crap out of me when I see people rolling down the road with the windows down on their trailer, and the horse has got the head hanging out, right? And they're going to
get decapitated if they hit a truck.
Yeah, or a rock pops up or hits them in the eye, something like that, right? And if you keep the windows closed, even if the vent is open, right, it still keeps a lot of the crap and the toxins out of the trailer.
What about the drop downs where you have the bars or nets in front of them, where their head's not out, but they're getting circulation, especially when it's 115 degrees out and you're trying to get air in there.
Circulation is important, for sure. So open the front and the back so they can get air moving through there would be important. And I would, I probably wouldn't put a lot of hay in there or something like that to get in the way, because then you should be kicking up a lot of dust. They're going to breathe that in as well.
Right. Because I've seen that where I've unloaded them and then let them get a drink of water and their heads go down, and all of a sudden a bunch of stuff comes out of their nose.
Yep.
And that's a lot of what we're talking about, is that stuff that gets in their airway that's actually letting it get out of their airway to keep that from happening. Because isn't that what created that pleural pneumonia?
It's a lot of things. They have to get exposed to the bacteria or something like that, and they have to be stressed, right? So hauling a long ways, being in a new environment, all those things are pretty stressful. And then just pay attention, right? Because a lot of times those horses will run a little fever. They just feel kind of bad for a day or two. And if you're paying attention to your horse, you can start treating it now before they get really sick. And horses are very good at hiding being sick. Like they evolved to be, to not display that. So they don't get eaten by lions, right? So if you're really paying attention to your horse, they'll tell you, just make sure they're eating, make sure they're drinking, make sure they feel okay.
What is kind of the temperature that you kind of like in your trailer? Because I've heard it to where I've heard some people say, man, I'd rather have it a little chilly in the trailer than too warm. And then, they're almost breathing their own air and it's humid in there and stuff, and where it gets hot in there, if that makes sense.
I think
like wintertime.
Yeah. I mean, ideal temperature for a horse is about 60 degrees. So cooler than hotter is better.
Cooler than hotter is better.
Yes. Yeah.
So I have heard that.
Yeah. If it's 25 outside, don't open all the windows and roll down the road like that.
Yeah. And obviously not freezing either. Yeah. Because that was an interesting one where I've heard some people talk about it's better to be a little cooler than be too hot in there.
Yeah, 60 to 85 is probably the best range you can keep it at, and it's hard to get accomplished.
What talk about when people are pre-purchasing a horse, or whether you're buying or whether you're selling? I like to always kind of talk to the people that are buying, because with the way things, the growth in the industry that I've been seeing, especially at the clinics and stuff like that, a lot of new people are getting into the industry. They're wanting to become a roper. Some people don't want to play golf, so they're wanting the team rope. And so what are some of the things that when they go and they find that horse, what are some things that you recommend, the questions that they ask and the things they, so like say soft tissue or, is the horse, have you ever colic before? What are some things and questions you would want to know that are really those red flags for you, if that makes sense?
Yeah. So we're probably going to get some death threats over this, just so you know. I guess the pre-purchase is probably, so the number one reason that equine vets get sued are pre-purchases, right? So and that is, usually it's a communication problem, right? It's not necessarily that anybody did anything wrong. It just didn't work out right? And you can't have a crystal ball. You don't know what's going to happen in 30 days. Horse could be perfectly sound today and not in 30 days. But if let's just say you're a novice in getting into the industry, right? Make sure that you work with a trainer that you have confidence in and you have a good relationship with, to make sure, first of all, that the horse is a fit for you. If you're buying it for your kid, make sure it's a fit for your kid. The kid can ride it, right? And you can be competitive on the level that you need to be. Like, you can't depend on your veterinarian to make that assessment for you. And I see pre-purchase reports where a veterinarian is commenting on the attitude of the horse and the behavior of the horse. And I just don't know that that's our place. And personally, it's not my place. And I almost never make any recommendations about
Well, having a trainer and having some guidance, I think, is huge.
For sure.
Absolutely.
For sure.
Because, if you're looking for this horse, does he buck?
Right.
That, to me, that's a red flag. Buck, railroad backwards, I'm out.
Yep.
And so, that's one of the things, because that's where, you just need to ride him. Well, sometimes when they say that, there's certain things they're trying to hide. So, having someone that's in the industry that you can trust, that is a good one. Yeah.
And the second thing is that have a budget in mind that you're willing to spend to do the pre-purchase, because I wouldn't be cheap on that, right? Because there's a lot of things you're going to find out about that horse on a pre-purchase that you're going to need to know about. And if you don't expect to spend $1,000 to $2,000, you're not going to find that out. So the horse industry and the way it is right now, I mean, it's so expensive to buy a horse. Like a prospect, if you can find a prospect for $20,000, you hit a home run. That you're spending 30, 40 grand for a prospect, and you're spending 50 to 100 on a finished head horse. Even an amateur head horse is 100 grand, 75,000, right? So to invest 2,000 in the pre-purchase, I think, is probably a good choice. And then there's a lot of things to consider. Well, we'll just walk through what a pre-purchase is real quick. So the first thing that I'm going to do is we're going to do a physical exam. We're going to look in the eyes, listen to his heart, listen to the lungs, make sure there's no obvious scars, no colic scars or anything like that we're concerned with. The teeth are good. Gut sounds are good, right? If we get through all that, everything's fine. Then we're going to do a lameness exam. Probably a little more intense than a typical lameness exam for me. We're going to make sure that there's tendons all palpate normally. The hoof test of feet, make sure there's not pain in the feet, make sure the horse is sound. And assuming that the horse is sound, then we can go talk about doing some x-rays. And I've had pre-purchases that we did typical front feet hock and stifle x-rays, which is going to cover 80% of the problems you're going to have with a rodeo horse, to where we x-rayed the neck and the back and the shoulders and the elbows and everything on that horse. And we spent $3,000. And anywhere in between, right? But the main thing you have to ask that you need to know is what's the expectations for the horse, right? And if it is let's say it's a cutting horse and it's a 4-year-old and it's a mare, right? You're going to be a lot more lenient on the soundness issues, because probably that's going to be shown for 2 more years, 4-year-old, 5-year-old, 6-year-old, then she's going to retire and be a broodmare if she's any good, right? That's different than a 8-year-old barrel horse, which is going to have to run barrels until it's 18, right? Those are totally different conversations. And then you have the guys that are coming in with a prospect, and they're going to ride it for 6 months to a year, and then they're going to sell it. And that horse has to pass the vet check when they do it the second time, right? So all those things go into consideration on what you find on your imaging, which can also involve ultrasounds, right? So let's just say I have a head horse that comes in and Dustin Egaskis is going to buy it, right? So the question I ask him first thing is like, what's the plan for this horse? Is he a jackpot horse? Is he a rodeo horse? Like, what's your plan? He's like, well, he's 6. I'm going to jackpot him and we'll sell him. Great. We're going to x-ray at least on some level, front feet, ankles, knees, hocks, stifles, and his back, just to make sure that if he does turn into the horse he thinks he is, and he's worth $150,000 in a year, that when someone else does a pre-purchase, he's going to pass and they're going to get him sold. Right. And if the horse is lame on the exam, or you find something on the physical exam, we'll have a conversation about that. Make sure everybody's happy with it. It could be something in the eyes, right? Is it going to be a vision problem at some point, or is it just going to be cosmetic, right? And if you find, let's just say that your x-ray on a horse has a chip in his knee, right? All right. Well, what's the plan for that? Well, the horse is not lame today. Chip's pretty old. It's round. It's been there a long time. Probably doesn't bother the horse. If you want to sell him again later, we should probably take it out, but it's safe to buy the horse. Well, the horse is lame. He's got arthritis in his fetlock. Can we live with that? Can we inject it and maintain it? Or is it going to be something that's going to shorten his career? So those are all questions you have to ask.
And one of the things I always kind of tell too is like things that I would tell some of those people that are going to take their horses is, you know, being able to talk to the owner is, has he ever colicked?
Right.
You know, I kind of want to know, are they, you know, because those are things you're not going to probably be able to tell, correct? Right. So those are things, if you're able to find someone that's honest, you're going to buy this horse from, you know, is he a chronic colicer, bleeder? Does he bleed? You know, things like that out the nose. You know, has he ever had soft tissue injuries? Those are difficult going forward, correct?
Yep. If it's a performance horse, you definitely need to get some history on it, and not even just the veterinary medical history. It's like, hey, what do you do to run your horse on, right? There are horses like they may run on Lasix, they may run on Kentucky Red, they might get Banamine, they might get Dex before they run every time, right? Those are things that you need to know, because to be honest with you, if you have a horse that is a finished horse and it's a performance horse, it's very rare that you find one that's clean, what you would consider clean on a pre-purchase. So if you find a problem, you need to know how they maintain that problem and how much of a problem it is. Like there's cutting horses, there is probably 10% of the time, especially if they're over 6, it's a weekend horse, that they're going to have a suspensory injury, soft tissue injury somewhere in their lifetime. And you're going to find that on a pre-purchase. You're going to see it with an ultrasound. And now you have to decide, you're taking one day of life that horse, and you're trying to help them make a decision on whether or not to buy this $100,000 weekend gelding that has a bigger suspension on his right hind than his left hind. And can you live with it, and can you manage it? And a lot of times those horses have never even been lame. It's just something that they live with for a long time.
Yeah. Because that's what I always tell some of the guys that are getting started is, man, 12-year-old horses and older, you know, get them ones that are just going to do the same thing over and over and over again. They're mature. They're going to be the mature one in the relationship. You know, they're going to help you learn how to compete, you know, so they're probably not going to be going at that full top level. Right. You know, so if there's a few cosmetic things, those are going to be some things that are going to be probably easy to deal with or maintain, as opposed to that high level where it could create, you know, more stress and more tear, you know, on certain issues, obviously. So those are things that I always kind of recommend for people that are looking for that horse, because you want a green rider and a green horse
it's a bad idea.
It's a bad idea. I'm not saying it's impossible, but man, the chances of you getting hurt are a lot more likely than sometimes it going that dream that you're after. So, and I always tell a lot of people too, is like when people are selling a horse, you know, those are big ones to be honest about, you know, hey, let this horse, you know, let this guy know if this horse has been a chronic colicer. Has he ever bucked? You know, what are some things that this horses that you've owned? You know, I always try to really preach on those guys is like, man, don't be the guy that's trying to inject a bad horse in somebody. You know, try to be as transparent as you can, because you only get one name, and so you want your name to be good. The hard part is when things happen and it's a surprise to everybody. Those are the hardest ones on the industry that are hard for the vet. It's hard for the seller, and it's hard for the buyer, to where when things sometimes just happen. Because that is what I think a lot of people don't understand, I think, get into this industry. There's a lot of unexpected things that can happen. That horse can be 100% sound when he left that vet clinic, and then he can get hurt the very next day, you know, and I've seen people get mad. Well, if it's had him vetted, well, you know, sometimes things just happen. So
one bad step.
Yeah. But yeah, that's a really good, I think, perspective and a lot of things to ask for a lot of people, because I get a lot of those questions on the weekends The main thing I always tell everyone is when they are looking for a horse, try to do some research on the guy that you're going to be looking for horses from. Is he a trustworthy name? Does he have a good reputation? And because I see a lot of people get hurt, that they don't know the questions to ask. So I think a lot of the questions you put down is a really good one for a lot of beginners.
It is such a blessing that I ended up working in the Western industry, right? Because it's not necessarily a small industry, but there's known quantities, right? And by and large, the people involved in it are good people, right? And so I would say there's a handful of people that sell horses that when they come in the door and I know who's selling it, that we're going to draw some blood and do a drug test, or at least I'm going to draw some and put it in the freezer, right? Because they're just the ones that you can't trust. But the amazing thing about this industry is that it is just so cool that you can pretty much trust everybody, right? And we sell horses in our practice, inside the practice, from one client to another, right? And the ability to do that and have it work out well it's just cool, right? It's just so appreciate the industry that way, that you can exist inside that space and be friends with everyone. If it doesn't work out, it's still okay. Like when that it does go sideways, most of our clients in this industry don't get mad about it. They understand that's just the way it goes. And, if we screwed it up, we're going to do our best to try to fix it. And if the guy selling the horse screwed it up, they're going to do their best to try to fix it. And everybody tries to get along.
Yeah.
Yeah. It's pretty handy.
Yeah, it is. And I agree with that. That it is a good industry, and it is small enough too, where you can find out. I think a lot of times too is if people know the horse or things like that too, where you have an idea. And I always recommend videos, competition videos. I want to see what he looks like. When the money's up too. So, just a couple last questions that I have, and then I'd love to get into you guys' breeding facility. But I'd like to talk just a little bit about nutrition. I've had some people ask me a lot of times, the difference between pellets and alfalfa and certain grains, for certain age of horses. What is some of the things that differences you feel like between alfalfa pellets and then hay?
So the pellets or cubes or hay itself, right? The pellets and the cubes are probably safer if you're worried about blister beetle toxicity, right? Which is a real thing. It doesn't happen very often.
Not as much as it used to, huh? Yeah. I heard about a lot more when I first got down here. But
I haven't seen one probably in 10 years. And then I used to see one every couple of years. And then, 10 years ago I had one, 15 years ago I had one, right? And that's about it. So it's pretty safe.
Now explain the blister beetles just for people to understand.
So blister beetles is it's an insect that is very toxic to horses. And like it can be just a small little piece, like an eighth of that insect. If the horse ingests it, it can kill them. Like it's a very potent toxin that causes inflammation in the gut, gives diarrhea. They'll slough the lining of the colon off. If they absorb enough of it, it can damage the kidneys to where they'll die. I mean, most of the time, a horse gets enough blister beetle, they're going to die. There's not anything you can do about it. You do supportive care, but that's about all you can do.
Is there a location where these horses or where these blister beetles are kind of known to be in at?
Yeah, I mean, it used to be any alfalfa hay that was grown in Texas or the lower parts of New Mexico or Oklahoma, people wouldn't buy it. But I think that we've done a much better job of managing those things. It's really pretty safe now. I don't think I'd worry about where the hay comes from. Up in the mountains, it's less likely to have it. But when they swarm, like they'll swarm in Stephenville, once a year, you'll see in the grass, there'll just be a bunch of blister beetles out there. If you do see them and you know what they look like, I would just turn my fly system off, until they go away. Because if they don't die, they're not going to get eaten. And that's how the horses get. The one horse that I actually saw 15 years ago, the blister beetles flew into the barn. The fly spray killed it, fell in the horse's feed bucket, and he ate it.
Oh, my dang.
Yeah. So wouldn't worry about them too much in the hay, but it's not a zero risk. It is. I've never seen a horse with blister beetle toxicity eating pellets or cubes. The problem with the pellets or the cubes, there's two things to consider. The pellets specifically, you need to have a certain length of fiber that's in the horse's diet that can stimulate the lining of the gut, helps the motility, and helps digestion. So if you don't have, I think it's 1/4 of an inch length of the fibers that they're eating, then you lose that ability. So some of the pellets that are super processed, like rabbit pellets, are not going to be good. There's some Equidine makes a good pellet, and Red Chain makes a good pellet that they have a pretty good length on the fibers, and those do fine. Those are well. The problem with the pellets and the cubes is that when they process it, sometimes you get issues with the dirt that gets stuck inside the cube and the horses eat it. So if you think about when you feed a Bella, hey, when you get done, there's a little bit of dirt left at the bottom of where that bale was sitting, right? It just falls out of the hay as you feed it. Well, that doesn't happen when you feed cubes. So I've seen some horses that actually get toxicity from too much iron. So it looks like the metabolic disease we talked about earlier, the Cushing's, they get fat. These are like 4-year-old horses, and they get fat and lethargic, and their hair grows long, and they look like crap. If they get too much iron, it mimics that. So just pay attention to where those cubes come from. So if they come from like Colorado, and honestly, the industry knows a lot more about it now, and I have not seen that problem in 4 or 5 years. So really, at the end of the day, there's not a whole lot of difference other than the cost. Yep. Hay's cheaper than the cubes. Cubes are more efficient, easier to haul around.
Yeah, they're easier to haul around. I used to love it. I put a ton of pellets up there in the trailer and rock on for a while. Yeah. Easier to clean, less waste.
Yep.
I just kind of always liked them chewing. It just always felt a little bit more. I mean, they're how God was kind of
designed to eat that that way. Yep. For sure.
But in the same sense, I've seen some of the top trainers that use it. Man, their horses look great.
Yep.
So
yeah.
What about grain? Is there a certain kind of grain? And as opposed to like if the horses are getting used, not getting used, age. Because I know like Omoline getting some fire in them or whatever, it like seems like them older horses, maybe a little bit more, docile, kind of wakes them up. But then to give, a 4-year-old, strong, hard feed with a lot of fat in it, they're sitting in a 15x15 stall that are just turning into a cougar.
Yeah, I think that less sugar, less starch is going to be better. More fiber and more fat is going to be ideal. That's for any age group. I think that we, as an industry, feed too much protein still. Even on the yearlings and weanlings, I don't know why you want to feed 18% protein to your horse. I think it's just too much. And if you feed too much to the young growing horses, then you get OCDs and developmental problems. So I think on a horse that's really intensely training, 12 to 14% is plenty. Growing horses, 12 to 14% is plenty. Older horses, 10 to 12% is plenty. 5 to 8% fat in your diet, I wouldn't feed any more than 8% because then they just don't digest it very well. And then limit the carbs. I think that's, for me personally, it would be universal on the feed that I pick. I just don't like feeding sweet feed. I don't like feeding high concentrate feeds to horses. I think you just run into problems. And we have fed them for hundreds of years, and horses have done fine on that. And 85, 90% of the horses are fine. It doesn't matter what you feed them. But I think if you err on the side of lower starch, higher fat, moderate protein, then it just makes it easier to feed everything, the same thing.
What about worming? How often do you try to do that? And do you try to switch your products up a little bit?
In a perfect world, you would do a fecal test on your horse and see what kind of worms you have. And then you would pick the appropriate product for that. And not many people are going to do that. So I think, any of the ivermectin products, which is going to be moxidectin as well. So Quest, ivermectin, Equivalent, any of those products are going to be fine. You're going to need to add some praziquantel to that at some point, which is going to get tapeworms. So Quest Plus, Equivalent Plus, Equivalent Gold, I think that's what it's called. Those products are going to be good. Every now and then you're going to need some fenbendazole, which is going to be Safeguard, Panicure. I think if it was me, I would probably do the Panicure or Safeguard January, February. I would try to worm 4 times a year if I could, every 3 months, just as a general rule. Ivermectin and Quest the other 3 times.
I've heard that switching those in certain seasons does do a good job because it kind of kills whatever those worms are kind of known for in that time of season.
Yeah, I don't know if there's a really good science, especially in horses that are confined in stalls. Seasonal. The main thing on pastures is to spread your horses out enough to where they're not eating their own poop. And if a manure gets exposed to sunlight and it dries out, the worms are dead. You're not going to have any transmission. So, fresh air and sunshine is probably the best thing for everything.
Yeah.
Otherwise, you just do the best you can. If you worm your horses too much, like 30 days or 60 days, you run the risk of having a resistant population of parasites. So then nothing works for them. So I wouldn't do it too frequently. Probably 3 months. And if your horses look bad and you're worried about them, you need to have a fecal test done.
Okay. What about the maintaining shoeing? I've had a lot of questions on that. I grew up shoeing quite a bit. My dad shod, studied it, a little bit and was on the road. And it seemed like to me, when the horses were getting rode a lot more at a very high performance level, it does seem like the feet do grow faster than for some of them that are just kind of either sometimes getting rode or they're basically not getting rode, but they're still having shoes on.
We're probably going to get more death threats over this one too, because people have a lot of opinions on this. And I will say, first and foremost, that I have an amazing amount of respect for horseshoers, farriers. Like, man, the job they do is thankless, right? And it is just work. I did a little bit in college, and it was a very good motivator to go to vet school.
Yeah,
because it's way.
Mine was a very good motivator to rope better.
Exactly. You can make a really good living, but man, it is physical. It
so
is
hard on that back. Yeah.
Yes. And it is virtually impossible to do at a high level on all horses, because some horses just have crap for feet. Like God made them with sorry feet, and they're going to live in some kind of corrective shoe in their whole life. And I think that the frequency of when you shoe your horses is going to be really depend on the horse. And
I agree with that too.
How fast the foot grows. Because some horses get the crap road out of them every day, and you shoe them every 6 weeks, and some get the crap road out of them, you shoe them every 4 weeks.
Yeah. Because I've had some, I noticed it in some of my horses, like in the wintertime, it seems like I could go about 5-6 weeks. But it seemed like summertime, I don't know if it was maybe the soft rides are creating a lot of, circulation in the foot. I don't know if it was the fact they were getting rode almost, dang near every day. The weather, the feed, I don't know, but it seemed like 4 to 5 weeks, because it seemed like 6, man. It seemed like they're growing over. It seemed like their heels were getting a little bit, I was losing a little bit more heel. So it seemed like the more I was riding them, it seemed the 4 to 5. And I have an eye for it, because like I said, I've shod, so I can kind of do it. I'm just kind of trying to talk to a little bit of the people that they can't see it. They don't have the eye for it. That the recommendations, I always say that even if you're not riding them, I wouldn't do more than 8 weeks. Even if they have a good foot, because you don't want to let it go too long.
Definitely not more. I mean, honestly, I wouldn't do more than 6.
6. Okay. Yeah. 6 is a good one.
Yeah. If it's an athletic horse, because what you don't want to do is create some significant imbalance in the leg going up, because the foot is probably the most significant factor in lameness in horses, right? And it may not be a lameness in the foot. A lot of times it's a lameness caused by the foot. So if your horse is shod well and balanced and shod appropriately period of time, then you minimize those other things that you have.
What's your thoughts between people that talk about they don't shoe their horses and the ones that do?
I think if you're in an arena sport, I think being barefoot is fine if the horse's foot will hold up to it. I would honestly prefer it because then they can wear them like they want to wear them. It's a little more forgiving. A lot of horses handle the ground better barefoot. But if you have a horse that doesn't grow a good foot, or they're saying in the arena wears the foot off in ways that you don't like, then you need to shoe them. So as a general rule, barefoot's fine. There's not very many rodeo horses that can handle being barefoot.
Yeah. I, this is a real sandy area here. And so I kind of like them staying barefooted, if they can, getting them started, because there's not as much rock that's going to kind of break.
Yeah.
But it seems like a competitive horse at a high level, it seems like they get the support they need. And, especially if you go from a sandy area to somewhere else that's rocky, you don't have to worry about them breaking off and stuff like that.
Depends what they do for a living too, right? Because sometimes you need rims, sometimes you need sliders, right? To do the things that we ask them to do and keep them healthy, I think that's also really important.
Yeah, I think the farriers and what they do a heck of a job to help them horses, in my opinion, compete at the highest level.
Yep, can't live without them.
Yep. Now, I'd love to talk about Valley Equine here in Stephenville, because I'm seeing where breeding is really is blowing up.
Yep.
You're seeing the futurities. You're seeing the certain breedings where people are wanting to get a certain bred horse for to be eligible for certain things. And I think now, as far as ropers, they're also starting to kind of see some breedings that they're starting to like, that are starting to be, because I think the barrel race world has really done a good job of, they have really identified a lot of the horses that notoriously do pretty good.
Yep.
I think the head horse has just we've notoriously just kind of whatever felt good, we bought.
Yep.
Well, now that the futurities are getting in line and they're breeding for them, and there's going to be a science of it, people are starting to look for certain breedings and stuff like that to try to mimic some of the horses that they like and stuff like that. So you guys have a breeding facility here in Stephenville, correct?
Yeah, so we're partners with Jeremy Barwick on Valley Equine Reproduction, which formerly Brazos Valley Stallion Station. And we have 40 plus studs that we stand out there, and we have mostly cow horse industry studs, cutting in cow horses, it's a few reiners, it's a few team roping horses, a futurity stallions, and then some barrel horses that we stand. And that facility is amazing. Like it's really pretty crazy on how it came about, because when I got to Stephenville, when I first moved here, there was Oswood Stallion Station in Weatherford, and Alpha Equine in Weatherford. That was all the breeding work, and there was nothing in this part of the world. There was Dustin Adams' family had the Millionaire Ranch down there in Dublin, but they had shut that down, their breeding program. So we started breeding some mares in the facility and grew that business into the point to where Jeremy Bark and I have been friends. I've done his work for a long time. And he's like, man, we should probably put a stud barn in down here. We started with 4 studs. And that's got to be 10 years ago, maybe. And now we've got 40 plus stallions that we stand, breed 3,500 mares and put in 500 embryos. And it's a pretty amazing facility.
I've heard a lot of positive things on Jeremy. I've never met him. I've talked to quite a few people in the industry. Mainly started hearing Jeremy Barwick's name when Gold Buckle started, when Drigger started coming up with that, and heard amazing things about what that guy does and has an amazing reputation. Yep. So I would imagine him being involved with it, that's going to be amazing as well. And it's great to see some rope horses in there as well.
Came up with a really impressive incentive program for the cutting horse and the cow horse side of it, to where we asked all of our owners to contribute $500 from the breeding fee into an incentive fund. So it doesn't cost anyone anything. It doesn't cost the mare owner anything. And if you show in the futurity or the summer cutting spectacular in the cutting industry or the snaffle bit futurity, there's an incentive that gets paid out to those horses. If it's a horse that we stand and you're in the top 10 in the open, in the non-pro and the amateur, then you get money. And I think we paid out like $1.5 million the last 2 years total. So then he started the Gold Buckle Futurity, and it's a similar process with those studs. Like, he's just, smart guy. Mm-hmm. And it's good for the industry, because it puts so much money back into it, and it allows the stallion owners to recoup some investment, right? Because when you have a young stud and you're going to start standing it, traditionally you would just give away as many breedings as you could, right? And it got so expensive to promote those horses. You're going to spend barrel horses and rope horses. You're going to spend $50,000 to be in all the incentives, right? $100,000 in the cutting industry to be in all the incentives, like the Breeders' Invitational and all those things, right? So those guys are just taking a whipping for 3 years until those babies start producing and they can charge appropriately for the stud fees. Well, this gives them the opportunity to say, look, I would love to give you a breeding, but I can't because I have all these incentives I pay out of this breeding. So instead of charging you $2,000, I'll charge you $1,000, right? So then they can cover their costs, still promote their stud, and they're in a spot to where they get a little more traction because they're in all these incentives that they can't be any other way. Like it's such a good deal for the industry.
Yeah. Yeah. And it's blown it up.
Yeah. And
really, really good to see it for roping.
Yeah. And I think the rope horse guys are going to start getting their own studs. They can promote their own studs. It's going to be pretty cool to watch. It was interesting to watch the barrel horse industry build their own reproductive breeding program, right? Like the cutting horse industry or the thoroughbred industry, the running quarter horse industry, like there's always been a breeding industry in that. And now there is significant money in selling yearlings for barrel horse people. And there's going to be money to sell yearlings and 2-year-olds in rope horse people. Like it's pretty cool to see.
Yeah. Because I think there's been such a hole in the roping world that there's such a saturated amount of ropers and not enough people making the horses.
Yep.
Where what's been good about the fraternities is it's created now a lot better trainers because now they kind of know what to train in those horses to be able to make them look good. And now you're starting to see in horses that age out that are able to go to a very wide, broad amount of people looking for those good horses. Yep. And you're able to see those horses from, track from a 4-year-old to sometimes when they age out to 6. And so it's really been good for the industry to create more horses for the ropers. And then also it's given a lot of people, I think, an understanding of how those horses are supposed to work. And a lot more trainers are getting into this sport where now you're creating more horsemen as well. So
you're training them how to rope, not necessarily go fast.
Yeah. Because we're so notorious for getting, blowed up cutting horses. I've had most of them my whole career. I've had blowed up barrel horses, just kind of got by. Well, now they're breeding specifically and training specifically to be a head horse or a heel horse. So some
of that's demand driven, right? Because the blown up cutting horses went from 5,000 to 25,000, right? And
big time.
Yeah. Well, I'll just raise my own.
Yeah. Yeah. What is there a website that you guys have where people can look and see what studs you guys have that you're holding? Yeah,
just Google Valley Equine, and there's the studs are listed on there on the website. Yeah, really well done website too.
Awesome.
Yeah,
awesome. Well, what about? So I know with all the spare time being a vet, that you have, when you're not trying to catch up on sleep or eating the right things. Talk about your nonprofit that you created, Fat Pony.
Yeah. So, wow, there is such a. It's the best way to say this without being politically incorrect. I think that the future of our industry, so Fat Pony Productions is a charity that we've started to support the Western lifestyle by engaging in youth activities. So youth equestrian activities, right? High school rodeo, junior high rodeo, those sorts of things, right? And not just rodeo, cutting, stock horse, all of those things. And I think it's important. Well, I'll tell you this, this was a defining moment in trying to get this done for me. I can't even remember how long ago it was. It's probably 10, 12 years ago. Actually, I think Barack Obama was president. So the political climate was pretty divisive, and Middle East wars going on, and people are mad about that. And I'm at the finals with my wife, and they have the stagecoach comes out with the guest of the night, right? And this is before they had a veteran presence every night, but that night it was some veterans. And as soon as the arm reached out to open the door of the stagecoach, and you could see that it was a military person, every single person in Thomas and Mack stood up, standing ovation instantly. And it gave me chills, to be honest with you, to be there. I'm like, dude, we need this attitude in our country, because all these people in here, they're not all on the same side politically. They're not on the same side ideologically, nothing, religion, nothing. They're not the same, but they all understand the way of life in this country and why it's great. And I think that the Western lifestyle supports that, but it's merit-based. No one gives a crap what you look like as long as you can get your job done.
100%.
Yeah. So we started talking about that inside the brain trust inside our practice, kicked it around for a while. And then last year we decided, you know what, screw it. We just got to get something done. It's important. Right. And then we got involved in sponsoring some youth stuff along the way as you go. And then it became apparent to me that there were a lot of people making money on youth stuff, which is, in my opinion, inappropriate. So we're trying to make it to where we can change the face of that industry to where let me say this, there is a lot of people that donate a lot of time and energy and resources into that industry with no return for them. But there's also people that are making money in that. And I want to make sure that the kids that need help to get up and down the road and get around and go to events and can exist in that space have the opportunity to do that. That there's kids that, if they have the opportunity, they can go to college on a rodeo scholarship. They can go to college on a stock horse scholarship and get some help. And I think it's better for the world if they're in that industry and they have an opportunity to get, be successful at life.
So what are some people that are some kids that would be looking for your foundation that would be able to help them?
We're not far enough down the road yet, but if they need something, they can contact me at the clinic and we'll see if we can help them. So
you just you said within a year.
Yeah.
We're when you guys just kind of got started.
Yeah. We started talking about last year, put the board of directors together, started talking about some different ideas. And then we've trying to get, honestly, the only thing holding us back right now is the IRS, and getting the appropriate tax nonprofit stuff done, which is not that easy to do.
Yeah, well, it's not. Yeah, not at all.
We're jumping through the hoops right now, trying to get everything done. But if there's something that needs to get done today, we can get it done. That's
awesome.
not the problem. Yeah.
Awesome. Well, we appreciate you at Liberty and Loyalty. You know, you've been a big sponsor of our American Heroes celebration there that we have in November. Last year, you were our military first responder sponsor for the roping. That when those guys make the victory lap there at Cowtown and they win it, they hold up a check with $15,000 for the header and a $15,000 check for the healer. It pays $30,000 to win that event. And you being our sponsor for the head side, and watching those guys, man, hold those checks up there live on the Cowboy Channel and making their victory lap, you know, the things that you're doing, that such a give back also to our military is very appreciated.
Man, I just appreciate the opportunity to be involved in that. Like, it's such a cool organization, and the stuff that y'all do is, man, it needs to be done. And like I told you before, like the way this country treats our military and first responders, the people that sacrifice a lot for this country, is embarrassing sometimes.
I totally
we need to do
agree.
a better job. And I just appreciate the fact that we can help.
Well, I had the same experience. You know, when this whole thing started was from Jackie and I basically having lunch and kind of created with the idea basically on a napkin. And, you know, we decided that we thought with our talents, maybe we can just have a clinic and see if any of these military guys rope. And so we just kind of had it here at the house. And, man, then it just blew up within, I think, 6 years of doing it. You know, we're getting hundreds of phone calls on the clinic. And then, so we decided to have a roping. And, you know, I have to give the credit first off to God and the fact that he was able to use my talents to be able to do something that was beyond my wildest dreams. You know, to be able to see what this has done and the outlet that this roping has done and created for our military and first responders has been, well, it's hard to put into words, and it's mind-boggling on how much it's helped. You know, what I thought was just kind of making a great day for them has become life-changing for a lot of these people. Yeah. And to be able to think now that with the sponsors and the team that we have now, you know, the guys that are with Liberty and Loyalty, between our board members and our ops members and our volunteers, you know, this last year, within 5 years, we've helped build over 5 homes for wounded veterans. Yep. We've helped the families of firefighters and police officers that have been tragically murdered in the line of duty or killed in, you know, firefighting, and then being able to, I think $1.2 million is what we've helped raise, you know, just within having this roping, you know, and then the guys too that just get to come rope. I mean, we had almost 400 teams this year in the military first responder roping.
That's cool.
And so to be able to see that, you know, even the guys that are amongst, you know, society, just being able to have that outlet and have a group there and just have basically a function and a get together where we celebrate these guys, because we're all appreciative of, you know, what they do for this country, what they do to keep our streets safe. You know, to be able to have that outlet in this industry has been awesome. And like I said, I didn't see what it did for a lot of these people until you start seeing them around their friends. And it's, you know, they've told me so much about what it does for them, you know, just even once a year. And so to be able to have the sponsors that back us and support us and being able to help, you know, provide this experience for them like you do, man, is so well appreciated.
Man,
so
it's needed. It is definitely needed. It is. Congratulations to you, man. It's just awesome.
I appreciate that. Yeah. So, but man, thanks for coming on the podcast, man. People that I've talked to, and, you know, trying to learn more about you throughout, you know, calling some people around, and just your work ethic that people talk about, your leadership that you keep within the vet clinic, and just the giving guy that you are. And we just appreciate everything you do. And
try to keep a low profile most of the time.
it's easier that way.
Yeah,
I'm a low profile guy myself. And I appreciate the advice. Like say I've developed a lot of following on this podcast for a lot of people getting into the industry and just learning more about the horses and stuff. So I appreciate bringing your knowledge and wisdom in there to where hopefully this helps quite a few people, just even if it just sharpens up their vet kit of what to have in the tack room and in their trailer. So
we have somewhere in our social media presence, first aid kit that we recommend. So if you find us on Facebook.
What's your social media?
Yep.
It's probably Signature.
It's not Signature Equine for sure.
Okay.
If you can find that, and if you can't find it, just shoot us a message and we'll repost it or get you. If you got questions, man, you can find an email on our website, signaturewine.com, or social media. We're on Instagram and Facebook.
Awesome. Because don't you do some tips as well?
We do.
On social media a little bit, correct?
We're working on cranking up our social media presence, and it's not really in my comfort zone, but I have people for that. So if there's anything y'all want to see, and if you're on TikTok, you can go find the Stroh Show. Dr. Scott Stroh-Snyder is one of our partners. He's very active on TikTok. And if you like to be entertained, his TikToks are pretty amazing.
Awesome.
Not always politically correct.
Entertained and knowledge at the same time. So that's a good mix.
Yes. There you go.
Awesome. Well, man, I appreciate your time, and I thank you for everything you do. So
thanks for having me. It was awesome.
You betcha.
Thanks.
If you've been wanting to get into team roping or improve your skills as a beginner header, now's your chance. Join us for the NRS Beginner Headers Only Clinic at the NRS Arena in Decatur, Texas, April 25th through the 27th. This clinic is designed just for the beginner headers up to a number 3, focusing on roping the horns, solid horsemanship, and the fundamentals you need to build confidence and stay safe while having a great time. And if you can't make it in April, we've got another clinic happening October 3rd through the 5th. So you've got another chance to get in on the action. Don't miss out. Spots fill up fast. Head over to charlycrawford.training or check the podcast description to get the link to enroll. We'll see you in Decatur.